I graduated from the University of Michigan School of Dentistry in 1986. From there I did what's called a general practice residency at the University of Texas in Houston, and then I was accepted into my surgical training program here at the University of Florida in Jacksonville, and I spent 4 years there. We had a strong emphasis in trauma surgery and also reconstructive surgery. From there I did a fellowship at the University of Florida in Gainesville under the tutelage of Dr. Frank Dolick, who's one of the most renowned TMJ surgeons in the United States. And then also I spent some time with Dr. John LeBanc, who does craniofacial surgery, microneurovascular repair, and then also some facial plastic surgery. Our goal, and I think we really achieve it very well here, but our goal is to make sure that when you come here you feel like you're part of our family, that you just feel really comfortable here. We spend some time with you. I don't just do like a quick, fast consult. We talk. And if there's questions you have, we answer it fully to make you feel comfortable. And if there's any issues where you have some anxiety disorders, or where you need additional help, then we can actually use some sedative techniques such as general anesthesia or IV conscious sedation. There's several options. I mean, some people are just nervous about getting injections and needle phobics, and in those cases we can use like IV sedation, where in some cases also in young children we have the ability to do inhalation agents where we can actually just use a mask and breathe them down. And, well, we use what's called cone beam CT, or a miniature CAT scan that we have here in the office. We use that for looking for tumors, sometimes aberrant places for teeth that we need to remove if they're in kids. We also use it for implant placement, looking at sinus morphology, and we can also use it sometimes in orthodontic surgery, where we take a full face CT and then plan major surgical moves that we do in the hospital. We also use what's called platelet-rich fibrin. That is where we actually will take and spin down your blood, your own blood, and we use those the factors within the fibrin. It's called platelet-rich derived growth factors, and then those are used in healing. So we'll use those in flap surgery. If we do any bone grafting, we'll use that also to aid in healing. As far as my family life, I have a wife, Katia. She's just a wonderful woman. 2 children. One is in college, the other one is in graduate school. I'm also involved in foster care with my niece. She's 16 years old, so we're excited to have her living with us. We are very active in our church, the Church of 1122, and volunteer there quite often. Involved also in foreign medical missions. I've been to Uganda a couple of times in a place called Masaka, which has a orphanage there that services about 80 children or so. We have been involved in setting up a medical clinic that supports the orphanage too, and so we actually have Ugandan doctors that we've hired, and we have a dentist there. And so, that's, for a small area of Uganda, that's a huge addition to them.